The American Rescue Plan Act of 2021 has passed the United States Senate and is expected to be passed again by the United States House of Representatives along a party line vote on March 10th. What support can Native American tribes expect in this latest stimulus bill? The Bureau of Indian Education will receive $850 million to be allocated by the Secretary of the Interior within 30 days of the bill's passing. These funds will be made available to Bureau-funded schools as well as tribal colleges or universities. The bill also adds $10 million to the Native American Programs Act of 1974 and adds language to the act to provide emergency grants for Native American language preservation and maintenance. Indian health funding is appropriated $6 billion, which is broken down into the following disbursements: $2 billion for lost reimbursements, $500 million for the provision of additional health care services provided through the Purchased Referred Care Program, $140 million for information technology, telehealth infrastructure, and Indian health electronic record systems, $84 million for maintaining operations of the Urban Indian Health Program, $600 million for vaccine planning, administration, and tracking, $1.5 billion to detect, diagnose, trace, and monitor COVID-19 infections, $240 million to establish, expand, and sustain a public health workforce, $420 million for expenses related to mental and behavioral health prevention and treatment services, $600 million for lease, purchase, construction, alteration, renovation, or equipping of health facilities, $10 million for potable water delivery. The bill also includes funding for Native American HUD programs such as $455 million for Native American housing block grants, $280 million for Indian community development block grants. In addition, funding is made available to tribal governments in the following amounts: $100 million for tribal housing improvement, $772 million for tribal government services, public safety and justice, social services, child welfare assistance, and other related expenses, $20 million to provide and deliver potable water. Both Senator James Lankford and Senator Jim Inhofe voted no when the bill passed through the U.S. Senate. Due to amendments added in the Senate, the bill must pass through the House again, and the Oklahoma House delegation, who are all Republicans, are expected to vote against it.